they
that
use.
they say is, they give options to the woman for surgery, several kind of surgery, chemotherapy, etc., radiation.
Radiation.
But they don't offer this to these women.
Yeah, that's a good question.
It should be.
I know they're, working with it and, working on this to come up with something that you can use for breast cancer. And here's the other thing though, does insurance pay for it? That's the thing. Insurance doesn't pay for everything. So they wanna see that you've done certain steps, like surgery, then chemotherapy, then radiation.
You have to almost be like dying, because even for
Yeah.
transplant, it's like you're on your last thread.
Yeah, it's I've seen a big change in insurance system.
Yeah.
HIV infection and AIDS. In the early 80s, physicians were describing a syndrome that involved the deficiency of the immune system. And they saw that people, they didn't know what it was, but they saw that a certain bunch of people were having the same things, and they would have these opportunistic infections such as Kaposi sarcoma, which is a rare cancer of the skin and blood vessels. And they didn't actually come up with what it was, the agent, the virus, until a couple of years later. But we didn't hear about AIDS much before the 80s. And then all of a sudden, they have this stuff that's going on, and they see these symptoms, and they're getting a bunch of people that can't fight, their immune system can't fight things, and they're coming up with opportunistic things like Kaposi sarcoma or pneumocystis, and they did a lot of work on it, and then identified this virus, and they gave it the name of human immunodeficiency virus, or HIV. And that virus destroys helper T cells. And the disease, if it progresses to the disease, then that disease is acquired immune deficiency syndrome, or AIDS. And that is the final stage of an HIV infection. And at the very beginning, when they had HIV, a lot of patients died. But now they have that therapy where they have a big cocktail of drugs that they're taking, and they're living much longer. So the HIV is an RNA retrovirus. It's in the genus lentivirus. It's an envelope virus, and it has spikes on it, those glycoprotein spikes. So those are the GP120 that is on that particular virus. It allows the virus to attach to the cluster of differentiation, which is a receptor site on the T helpers cells, and it also can attach to macrophages and dendritic cells. After the virus attaches, it enters the host cell, and its envelope then is uncoated. In an animal virus, the whole thing goes in. It's not like a bacteriophage. The whole virus goes in, gets uncoated, frees up that viral RNA in the host cell cytoplasm. And HIV contains molecules of the enzyme reverse transcriptase, and that's used to make a molecule of DNA using the genetic message that is on the RNA molecule as a template. The normal way is that you would make RNA from DNA, but this is an RNA virus, so it has to use that. That's why it's called a retrovirus, and it has to use that reverse transcriptase enzyme. The DNA molecule that gets made integrates into the host cell's DNA, and then when it's in there, it transcribes its genetic message into new HIV particles. Or it can remain latent in the host cell's DNA, the viral DNA, as a provirus. And it can just do nothing for decades. Viral particles bud from the host cell membrane, and it carries with it an envelope and spikes, and now it's ready to go out and infect other T cells. So stages of an HIV infection. Phase 1, infection may be asymptomatic, you may not even know you have it, or it can cause a persistent lymphadenopathy, where you have swollen lymph nodes. Phase 2 is you get these persistent infections. The one thing is by Candida albicans, and the patient may get shingles, persistent diarrhea and fever, and have precancerous or cancerous conditions.
Ma'am?
Yes.
Would they be able to detect it if they drew your blood for HIV?
Pardon?
When they, like, if they draw your blood and they do the HIV test,
Uh-huh.
how soon can they detect the infection?
You mean how soon after you contacted it?
Yes.
Good question. Yeah, I don't know if it's an immediate thing or they have to have enough viruses that,
5 to 6 months after infection, you will have a positive test.
pardon?
After 5 to 6 months, when they test you, they will understand that you got it.
4 to
Before
6 months?
No, 5 to 6 months.
5 to 6 months.
But before it, when they test, they don't see anything. But after 5 to 6 months, when they see the amount of the white blood cell, they understand that oh, something is going on the next.
So, Seema's saying 5 to 6 months before they can detect it.
And also if the person suspects that had a contact with another person who may have AIDS or may have the virus, they need the preventive treatment. So even if they are negative, they need provide medication for prevention.
And
Yes.
Virginia's saying, if you've had contact with somebody that had AIDS, where you're crossing blood, that even if you test negative, that they're going to preventively start giving you medications to counteract it. Phase 3 is clinical AIDS, and then you start getting those indicator conditions such as pneumocystis, pneumonia, toxoplasmosis, Kaposi sarcoma, tuberculosis. So for a while, your body can keep up with the virus, and it keeps, remember the virus is attacking your immune system cells, the T helper cells. So as those get destroyed, your body makes more T helper cells, and it keeps up with it for a while. But after a while, it overcomes your immune system, and you get a decline from 1,000 of these T cells per microliter to less than 200. So about 1 million people in the United States have HIV infection, and the World Health Association estimates 33 million worldwide are infected, and there's about 8 million deaths per year from AIDS. Transmission is primarily from infected blood, and that would take 1,000 to 100,000 viruses per milliliter, or semen only takes 10 to 50 viruses per milliliter. That's probably microliter, milliliter. So through sexual contact, if you have cuts or abrasions or bleeding, then it gives the virus access to your bloodstream. To decrease the spread of AIDS. Should be using condoms. Shouldn't be sharing contaminated needles if you're a drug user, because that's another way that it can be spread. It can cross through the placenta of a mother that is infected to the child. Also can go through in the breast milk. And also another way it gets spread is through blood products when you're in the medical field. Sticking yourself with a needle that contains, that you've used on somebody that has HIV. So some of the diagnostic tests for the detection of HIV is the ELISA and Western blot test. And in the newer test is called the viral load test. There's other tests too in your book. And this viral load test detects the RNA of the HIV virus, and it also can assess the extent of the infection. And with this one, almost 100% of the infected patients can be detected. There's lots of treatments that they're done and that they work on. One of the current treatments is this highly active antiviral therapy, or HAART. It's responsible for the drop in death rate. And this is where the patient takes about 40 pills a day. Oh, I probably take 40 vitamins a day. So you can do it. Vaccines, they have an inactivated whole vaccine, viruses, but you know, they're working on this stuff. But the possibility that you could have active HIV in those vaccines. They're working on a synthetic viral fragments such as GP, which is glycoprotein 41, and GP120 proteins that are found in the envelope spikes of the HIV. The problems that they have with working on these things is that they don't have any animals that they can use it on, like, you know, you can for other things. And and you can't give it to people. And the problem also with coming up with a vaccine is that HIV tends to mutate. So if you had a vaccine that was effective against it, the virus could mutate, and then it would avoid your antibody response. Okay, take a break, and we'll come back and do